Welcome back, everyone. Thank you for joining us. I am Steve,
And I'm Scott,
and together we are Backyard Musings.
the Science and Technology Channel.
If it's science or technology, we like it, we love it, we want more of it.
Yep.
Okay, so let's get into. I'm in Utah, Scott's in Apple Valley. So let's get into this. A new study conducted by researchers from Mass General Brigham, the Harvard T.H. Chan School of Public Health, and the Broad Institute of MIT and Harvard suggests that replacing butter with plant based oils may offer significant health benefits, including a reduced risk of premature death. So when I first saw this, I had to reread it and reread it. Okay, replacing butter with, okay, so get rid of butter. And I'm thinking, that's going to be hard, man, because butter loves me.
Well,
Seriously.
it's weird. It's kind of like the coffee and tea and wine, and it seems like and red meat, and it all bounces back and forth. Because I remember for a long time, butter bad, margarine good, and then they said no, the what is it, hydrogenated fats and stuff in margarine are not good for you. You should go back to butter. So I don't know. This is kind of confusing, but we'll go with it.
Well, as we go through it, you'll understand it clearly. I had to do a second take. Okay, the study, which tracked the dietary habits of over 200,000 individuals for 3 decades, found that diets rich in butter but low in plant oils were linked to an increased risk of mortality. That means an increased risk of death. The findings were published in JAMA Internal Medicine. We've reported on articles from this journal before, and were also presented at the American Heart Association's EPI Lifestyle Scientific Sessions. Would you like to know more about this?
Okay, so that JAMA, that is like the go-to journal for medicine, right?
Yeah, yeah,
It's Journal for American Medical Association or something like that. Medical Association. I don't know.
yeah.
Anyway, it's the go-to. So, analyzing dietary and health data from over 200,000 individuals over more than 30 years, the researchers found that higher consumption of plant-based oils, particularly soybean, canola, and olive oil, was linked to lower overall mortality, as well as reduced deaths from cancer and cardiovascular disease. In contrast, butter consumption was associated with an increased risk of both total mortality and cancer related deaths. One limitation of the study is that the participants are mainly health professionals. Interesting. So they might not represent the U.S. population as a whole, the researchers said. In the future, they'd like to study the biological mechanisms underlying why this dietary change has had such a large impact. So,
Hey, with 200,000 people, I don't care if they were astronauts or car manufacturers, mechanics. I don't care. That's a big number.
that is a big number.
Right?
Yeah.
So here's a quote. What's surprising is the magnitude of the association that we found. We saw a 17% lower risk of death when we modeled swapping butter with plant based oils in daily diet. That is a huge effect on health, said study lead author Yu Zhang, MBBS research assistant at the Channing Division of Network Medicine at Brigham and Women's Hospital, a founding member of the Mass General Brigham healthcare system. Oh, it sounds impressive. Zhang is also a student in the Department of Epidemiology at Harvard Chan School.
A key difference between butter and oil is the types of fatty acids contained in them. Butter is rich in saturated fatty acids, while plant based oils have more unsaturated fatty acids. While there have been many studies on dietary fatty acids, fewer studies have focused on their primary food sources, including butter and oils. Many previous studies have looked at a person's diet at a point in time, and have been done in small population, limiting their ability to public health. So yeah, this is what I'm talking about, the bouncing back and forth. So, because
I put butter on French toast. Oh, it's delicious. When I'm making like scrambled eggs or just fried eggs, I put butter in the pan. This is going to be tough, man. I know I got to make this. I'd like that 17% increase.
you
If
put
I'm
butter in the pan, if you don't have bacon grease.
That's right. I use bacon grease first.
But we won't go off on the health studies of bacon grease.
Bacon makes everything taste better, man.
It does. It does.
So the new study analyzed dietary data from 221,054 patients in the Nurses Health Study, NHS, Nurses Health Study 2, NHS2, and Health Professionals Follow-Up Study, HPFS. Every 4 years, they answered questions about how often they consumed certain types of food. The researchers used the data to estimate how much butter and plant oils they ate. Total butter intake included butter from butter and margarine blends, spreadable butter added to food and bread, butter used in baking and frying at home. The intake of plant-based oils was estimated based on the reported use in frying, sautéing, baking, and salad dressing. The researchers also identified participants who had died and their causes of death using statistics. So I wonder, how would you respond to the survey if you're dead and say this was my cause of death?
Yeah, well, I don't know if that could be done in writing. You could possibly have somebody, I don't know, maybe somebody witnessed your demise. I don't know.
Probably. Okay.
I mean, go ahead.
No, I'm just going to continue on. You go ahead. You're going to make a comment.
Well, I was going to say, how much butter did they consume? I mean, were they just like slathering it on like it was crazy? Like when my mom used to make, so most people use mayonnaise on the sandwich. My mom used to use butter on a sandwich. Turkey sandwich, ham sandwich, she used butter.
Yep.
And she would slather it on pretty quick. She lived till she was 94. Almost 95. So, but she didn't do a lot of other things that people do. But 17, I don't know.
What's 17% of 95? Let's see here. 95.
Almost 75, right?
That's 16 years plus 95.
80?
She could have lived to be 111. She would have cut out that butter. That's crazy.
Yeah, I don't know if I would have been able to take that.
My wife's laughing at me.
Well, I didn't. My relationship with my mother wasn't the best, so I don't know if I could have been able to take another 16, 17 years. So anyway,
all right. So using statistics to compare death rates across different diet intake levels, the researchers found that participants who ate the most butter had a 15% higher risk of dying than those who ate the least. In contrast, those who ate the most plant-based oils had a 16% lower risk of death than those who ate the least.
So this is a quote. People might want to consider that a simple dietary swap, replacing butter with soybean or olive oil, can lead to significant long-term health benefits. That's said by corresponding author Daniel Wang, MD, SCD, whatever that stands for, of the Channing Division of Network Medicine at Brigham and Women's Hospital. Wang is also an assistant professor in the Department of Nutrition at Harvard Chan School and an associate member of the Broad Institute of MIT and Harvard. Again, quote, from a public health perspective, this is a substantial number of deaths from cancer or from other chronic diseases that could be prevented. Okay.
The researchers also did a substitution analysis, which mimics how swapping butter for plant oils would impact the health in a feeding trial. They found that substituting 10 grams of butter a day, less than a tablespoon, with equivalent calories of plant-based oils could lower your cancer deaths and overall mortality by 17%. Quote, even cutting back butter a little and incorporating more plant-based oils into your daily diet can have meaningful long-term health benefits, Wang said. So check this out. I like toast, and and Cameron likes toast too, and we'll slather it with butter. But something that we learned in Italy, you just take that toast and you put olive oil on it. You dice up some tomatoes and basil, and just crush up the basil. It's like bruschetta. It's like amazing
for breakfast.
As a snack, yeah, breakfast, yeah. As a snack, those tomatoes on that toast with the basil. Oh, Scott, you gotta try it, man.
You lost me at the oil. It's like going to an Italian restaurant. They give you the bread and then they bring you out, instead of butter, they bring you out that little
Yeah, the oil. Yeah.
the oil mixed with all kinds of stuff, spices and stuff. Yeah, I'm not into that. Yeah,
I'm gonna try this.
oil is for frying if you don't have butter. So
I'm gonna try this. I'm gonna cut back on butter.
are you?
Use oil and bacon grease.
Well, if you got any butter you want to get rid of, just let me know. We'll take it. I'll trade you. I got a couple bottles of oil that I can swap for some butter. So
Yeah, I don't know where. I don't want to know where you got that oil from. So
Butter for baking.
at the
there
store.
you go. Okay. All right. Okay. All right. Thanks, folks. Thanks for joining us. We'll catch you on the next one.
Take care, everyone.